Hi everyone, welcome to our YouTube recording for week 7 and 8. This week we'll have our preparation and exam week, so you have some time to go ahead and prepare for exam number 2, get the exam taken, and hopefully get ahead on some of your readings for the nutrition module, which will be starting next week. Exam 2 will open on Tuesday at 8 a.m. and close on Friday at midnight. Once the exam closes, I'll always look at the exam and make sure how each item performed well enough. And if you get an email over the weekend, you'll know it's because either an item you missed was likely dropped. So if you don't get an email, you know that either no items were dropped or you didn't miss any of the items that were dropped, so everyone got credit. We will be having our exam review on the 26th during our open office session at 2 p.m. Eastern. Please try to attend if you can. We'll go through the exam questions and answer any questions that you have about those topics on the exam. And if you would prefer to do an individual review, I'm happy to do that with you. Just let me know and we can set up a time to do that. I'm going to be teaching at Hayden for Frontier Bound this coming week, so I'll be available by email and text. My phone does work, so I can get calls, but it's usually better with the teaching schedule if you just shoot an email if you need anything. Sorry, fighting a cold like a lot of you probably. Next week, our topic is Module 7, Nutrition in Pregnancy. We'll be discussing how to do dietary assessment, what nutrients are needed in pregnancy, how to counsel women about their diet, and also some special situations like obesity, vegetarianism, pregnancy after bariatric surgery, those kinds of things. I have returned many of your office visits. The remainder of those will be returned sometime in the next week. So by next Friday, you will all have them back. Remember, it does take about 10 days from the time of the due date for us to get all your assignments back to you just because of the quantity of assignments. So there are still some more extra credit opportunities coming up, so keep an eye on the course forum. I'll try and post an announcement in the announcements as well, so you'll know when it happens. I believe it's coming up in the last week of February, and if you didn't get a chance to complete the other 2 extra credit assignments, you can certainly do that now. Go ahead and just send me your certificate from the course. Since they popped up at the bottom of the course and so many people didn't see them, I've decided to go ahead and just accept those extra credit assignments, all 3 of them, until March 1st, which is the due date for the 3rd extra credit assignment. So be sure you get them all done by then. Our forum discussions will be resuming next week with those of you who have forum posts in Module 7, and we will hopefully have a lot of discussion in the modules about that, so you can help apply clinically some of your information from the readings and the course work that you do. So this week it would be a good idea to start those Module 7 readings and kind of get ahead a little bit for the last 3 modules in the course. And the next module is pretty important. It makes up a large part of what you'll be doing in clinicals as well as the exams. So make sure you take time to participate in the forums and help out your colleagues who are doing their forum posts. Office visit number 2 is coming up. It's due Friday of week 9, which is March 7th. And if you have any questions, you can feel free to send an email and we'll discuss those questions. The other assignments, as far as those, your SOAP note assignment is due Friday of week 10, which would be March 14th. And the childbirth education assignment is due Friday of week 11, which is March 21st. And if you haven't gotten a grade yet from your forum post or your oral office visit, please contact Kelly Wilhite, who will be in touch with you about why that is. First thing to check is that you have put your case into the Dropbox, and that's usually the biggest reason why you don't have a grade back is because your case wasn't put in the Dropbox or it didn't stick when you put it in there. The only other assignment then that we have for this course is the final course reflection, which is due on Friday of week 11, which is March 21st, and you'll find that in the term assignments folder. I want to review some other important dates and incomplete request requirements. So the final withdrawal day for this course is March 2nd. You should have grades from many of your assignments by then. If you're considering withdrawing for any reason, what I recommend you doing is adding up all the points that you've earned by March 2nd and subtracting them from 400, which is the number of points that's required to pass the exam, or the course, sorry, 400 points to pass the course. So if you add up all the points that you've received so far, you'll know how many points left you have to earn in order to pass the class, and that'll tell you the number of points that you need to earn on your remaining assignments and the last exam. Also, because of the 80% exam rule, you'll want to take your score on the first 2 exams and subtract that from 240. and that's the score that you'll need to get on the third exam. If you don't think that's realistic, then you may want to consider withdrawing from the course. If it's impossible, like you have to get 104 or something, which I can't imagine happening, but it could, then you would definitely want to withdraw because you won't be able to meet that 80% exam rule. So that's the best way to kind of see where you stand. Sometimes in Angel, if you look at your grade there, it will look strange because of the way Angel calculates the your choice assignments. So it's safest to add up your own points and subtract the way I explained rather than trusting Angel to give you a good picture of where you're at, just because of how it calculates the points. The final day to request an incomplete is March 21st. And to request an incomplete in this class, you need to have completed at least 3 of the 4 Your Choice assignments, both of the exams, 1 and 2, and you have to complete the final course reflection. So this might be convenient, for example, if you need to attend a childbirth education class that's occurring the day after the term ends or something, then you could contact us about that, and we may suggest that you take an incomplete and finish it later. If it's the day after, maybe not, but we need to just talk about how how we would handle that. So if you just need more time for your last assignment, that's an option for you. Upcoming BBCs. This week's open office will be on the 19th at noon Eastern. Feel free to come if you have any questions about content from the past 3 modules or even before that, and we can talk about it. You can certainly attend that and answer any last minute questions you have before taking the exam. I will be in Hayden, like I said, so if there is a chance that my teaching schedule there may cause me to need to change the time for that open office. And I don't know what my schedule is going to be till I get there and if I can make it. So once I'm there, if I cannot do it, I will post something in the course announcements letting you know that it's been changed, and I'll tell you when it's been changed too. Likely it would be closer to the end of the week. We will not have a module BBC or the live lecture for Module 7 because there is a Camtasia in the module about nutrition and pregnancy. So you don't need to worry about attending a live lecture during Module 7. Our next open office then after the 19th will be on the 26th at 2 p.m. and that will be our exam review for the second exam. Now, several of you have emailed me, told me you're just kind of stressed about the content in Module 4 because it seems like there's just so many different things that you might need to know. So I thought I'd give you some helpful hints related to what you should focus on from that module. Okay, so the lab module. First off, routine prenatal labs. Basically, you should understand the normal prenatal labs that we draw in pregnancy and what to do if they are abnormal or unusual. For example, if a woman is Rh negative, that's not abnormal, but it is unusual in the sense that you would need to have a plan for that. And so you would need to know what that plan is. You don't need to be able to distinguish different types of anemia. That's covered in advanced antepartum, but you should know the CDC recommendations or what the limits are normally for diagnosing anemia. So you need to know if a woman is anemic, but you don't need to necessarily know what type of anemia or how you would treat it or what other, specific indices you'd look at to make that diagnosis. Okay. You should know how to follow up if you get an abnormal prenatal lab result. So look at the routine prenatal labs. If they're abnormal, what are you going to do? That's something that you'll need to know in clinicals, so you need to know now. One thing that students sometimes have difficulty with is the Group B strep screening. So here's the deal with that. All women get screened for Group B strep around 36 weeks gestation, except if they've had a previous infant with GBS sepsis. That does not mean if they were GBS positive in their last pregnancy. It means if they had an infant who was sick, okay, who had GBS sepsis, then they do not get screened. If they have had a urine culture during pregnancy that showed any Group B strep in it, then they do not get screened. In those 2 cases, they would automatically get treated prophylactically in labor with antibiotics, okay? During pregnancy now, they may have a urine culture that shows greater than 100,000 of Group B strep, which is a whole lot. Because remember, you don't see Group B strep in the urine unless they are heavily colonized with it. So if you get any GBS in your urine, then you're heavily colonized with Group B strep. If you have more than 100,000 of GBS in your urine, then that would be a UTI that you would treat during pregnancy. Anytime you have more than 100,000 of any kind of bacteria on a urine culture in pregnancy, you would treat the woman for a UTI. Okay, so if a woman has had a GBS infected infant in the past, or if she has GBS bacteria, then she automatically gets antibiotic intrapartum prophylaxis. Okay? If those cases are not the case, then you would screen her at 36 weeks for Group B strep. If you have any questions about that, just put it in the course forum and we can talk about it. You should know about other screening labs in pregnancy. For example, like when do you do a 1-hour glucola test to screen for gestational diabetes? When do you check for anemia in pregnancy and why? When do you do a pap smear? Do you do it on everybody at the first OB visit or not? You should know who gets screened for HIV. That's an opt-out test. So every woman should be screened for that in pregnancy, right? And you need to know what to do for any other like unusual or abnormal values. So if I said this is a prenatal lab panel result, what are you going to do? You would need to know if the lab was normal or abnormal and what your plan of action would be. Now, about optional genetic screening labs. You need to know what type of genetic screening test would be appropriate for which patient in a certain situation. So if you're given a scenario with a woman and she's described and it asks what screening lab test would you use, you would need to know. So you need to know which screening lab test is appropriate for women at different gestations. You also want to review how to discuss genetic screening tests with women. And some of you did this in your office visits, this last office visit. But you want to be sure that you know how to explain risk to women as it relates to genetic screening. Remember that in Module 3, we learned that the most common reason for a size dates discrepancy in the first trimester is inaccurate dating criteria, right? So, in the same vein, if a woman has an abnormal genetic screening test, then it's most likely due to inaccurate dating. You don't need to know which components of the quad screen are elevated in which problem, like how many multiples of the mean or anything like that. And you do need to know which tests are most sensitive for detecting genetic abnormalities. So if I came in and said, I want genetic screening, which test is the best for me, you would need to know how to answer that. So those are your helpful hints. For wrap up, please go ahead and post any questions you have in the course forum, and we'll discuss those, or come to the open office if you have any questions this week. And good luck with the exam. And I hope you all do well, and we will see you in the forums.